Hello everyone, I am Dr. Srinath, consultant neurosurgeon at Renova Hospital, Kompally. Today I am in front of you to speak about the topic of the brain tumors. When we say the word brain tumors, we include any abnormal multiplication of cells which are normally found in the brain, leading to a physical space occupying lesion in the brain. So brain tumors are broadly classified into benign and malignant tumors. So most of the commonly encountered tumors are benign tumors, and some of them can also be malignant tumors. The benign tumors are classified based on their property of slow multiplication and growth rate, leading to gradually increasing size and over a period of few years or months developing of some symptoms. So when we come to the symptoms, the most common symptom which we encounter is the headache, and the next followed by weakness or numbness of any particular organ of the body, and also any particular deficit or loss of function of particular nerve or a part of the body. The other important symptom will be the seizures or epilepsy occurring due to the presence of tumor in the brain. When we come to the benign tumors, the most common tumor which we encounter is the meningioma. This meningioma is arising from the covering of the brain called the dura mater or meninges, and it slowly grows over a period of years, and therefore it is a benign tumor which causes its symptoms because of the slow increasing size of the tumor. So when we encounter this meningioma, we usually advise surgery, and total removal is followed by near normal recovery. So there are some types of meningiomas which are called aggressive type or high grade meningiomas, which upon the basis of histological or microscopic appearance can be classified as malignant type also, which therefore will require further treatment with radiation and chemotherapy. There are many other such similar benign tumors, which again the treatment depends on the location of the tumor, the rate of growth, and the symptoms which are associated with the tumors. So there are many types of approaches to these tumors, which probably commonly we know as the craniotomy or open excision of tumors. There are other methods of to removing the tumor called endoscopic type, where the tumor located in the ventricles or the fluid-filled cavities in the brain can be removed with the help of an endoscope and with appropriate instrument. The other equipment which are required for these surgeries are the operating microscope, as well as the various advances in surgical equipment called the cavitron ultrasonic aspirator or CUSA, which helps in the gradual removal of brain tumors without damaging the surrounding important nerves or areas of the brain. The next or most commonly encountered tumors are the gliomas. The gliomas are usually classified into four types. Two types, the first and second grade, are called the benign type. The third and fourth grades are called the malignant type. When we encounter any grade 1 or 2 tumors, usually the patient is followed with serial MRI, followed by the tumor changes in size or increase in symptoms. The tumor is removed with surgery, and any radiological evaluation which shows the tumor to be grade 3 or 4, the surgery is immediately indicated, and as much as possible the tumor has to be removed and followed by the chemotherapy and radiation therapy depending on the biopsy of the report. So once we encounter the high grade tumors, the survival also depends on the grade of the tumor. Usually in grade 3 or 4 tumors, the survival rate depends on the extent of tumor removal, the response of the patient to the chemotherapy and radiotherapy. Usually if these high grade tumors are not operated, the survival is less than 2 to 3 months, and if operated without chemotherapy and radiotherapy is around 6 to 8 months, and if it includes the adjuvant therapy called the radiation and chemotherapy, the survival is 1 to 1.5 years. Therefore, the universal bad prognosis or bad result is expected in grade 3 and 4, and the good result is expected in grade 1 and 2 tumors. So all patients who undergo surgery for brain tumors will need to be followed up regularly with their neurosurgeon with serial MRIs in order to gauge the response of the tumor to the treatment, whether the tumor is growing again or at what rate it is growing, or any other new type of treatment will be needed for managing the tumor. All brain tumor surgery patients need to be put on anti-epileptic treatment, because any presence of abnormal tissue in the brain is a cause for seizures. So all such patients, if they are serially followed and treated appropriately, can lead a normal life with a good quality of life. Thank you.